I've recommended a weight regimen program for you. What does this mean? Right now, we need to get you in shape. We need to get you in shape for a number of different reasons. Number one, if we're going to do surgery, we need to get you in shape so that you will recover faster and you actually have a better chance of outliving the cancer. There's several studies done in the last 20 years that have actually proven that patients who are obese and are overweight prior to surgery have a significantly higher risk of dying of their prostate cancer. Again, they will die of their prostate cancer if they are overweight, not because they have a heart attack or a stroke. So that is a particularly important point that I want you to realize. And the third thing is you will feel better. Okay, how do we do this? Number one, we've got to recommend a particular regimen for you. I'm not going to put you on Weight Watchers. I'm not going to have you count your points. What I want you to do is change the way you eat. The two books that I recommend are The Paleo Solution by Rob Wolf, which basically says if you can't kill it and you can't pick it, don't eat it, okay? And what it is, it's talking about eating proteins, eating vegetables, a little bit of nuts, a little bit of berries and vegetable and fruits, and you're pretty well good to go. If you do that 6 days out of the week and then one day you cheat a little bit and have some pizza and beer, you're going to do fantastic. The other book I like a lot is what's called The Perfect Health Diet. It's very similar to The Paleo Solution, but it's a little bit more lax in terms of some carbohydrates on there. These are great books. Again, The Paleo Solution by Rob Wolf and The Perfect Health Diet. Either one of those will really put you down the path to success. 80% of weight loss is diet. The other 20% is exercise. When I ask patients what they do for exercise and they tell me they walk the dog, the next thing I ask them is, what kind of dog do you walk? And if they don't tell me it's a greyhound, I tell them it's not exercise. Because if you're not running with that dog and you're not sprinting with that dog, I don't consider it exercise. So one of the apps I like on the iPhone and the Android, as well as a book, is called Max Capacity Training. We're going to have one of the navigators give this to you so you understand, what the name of the book is. But the bottom line on this is that all I'm asking of you is 16 minutes of exercise 3 to 4 times a week. And it's body weight exercise. You don't need to go to the gym. You don't need to go buy kettlebells. You don't need to go buy a barbell system. It's just you and your body. And you'll find that the incentive for you to lose weight is that the more weight you lose, the easier these exercises become. At the end of the day, the better shape you're in, the longer you will live, the fewer side effects you have, and the better off you're going to be. Good luck.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.